much as it is. You can't really see anything on it right now, but I will make sure you can. Remember I said you were going to see a tongue-looking like structure? That is the epiglottis. See it right there? If I go below that, so epiglottis is one of the cartilages. The other thing I can find is I can feel the hyoid bone right here. So we'll see the epiglottis. Epiglottis' responsibility is to flap back over the glottis, so when you swallow food, it goes in the correct passageway. Now, also what we have, and we should be able to see a little bit better, and it doesn't look like they dissected it. I apologize for that. I thought they would have. You're going to have the thyroid cartilage. When you think about your Adam's apple, that's a portion of your thyroid cartilage. That's the ventral median prominence. When I go inside, can you see these structures right here? Those are the arytenoid cartilages. The things that look like a baseball cap, blowing pork chop, blow dryer, Volkswagen Bug, right there. Those are the arytenoids. There are 2 of them. Now, this might have been cut so low that I cannot show you the cricoid. And because it's not dissected, I don't want to tell you that's what it is when it isn't. This piece of plumbing that's in the back, notice the rugae or ridges in it? That makes that the esophagus. Does that make sense? Because if we have the front, where the thyroid cartilage actually should be, posteriorly, we're going to have the plumbing in the back, so that we will have the esophagus. Inside, arytenoid. This would connect to this. Like that. Now, obviously this is the trachea. That's what I'm hanging on to. It has the cartilaginous rings. Posteriorly, that's where the trachealis muscle is. And we did talk about what the function of trachealis is, because the esophagus is back here. You'd be able to compress this area without difficulty so you could swallow the bolus of food. The next thing that's going to happen is you will see this. This is going to be the covering over the heart. This is parietal pericardium. It's a membranous sac that's laden with fat typically. And if we look at the heart, we can automatically tell here's your right ventricle, here's your left ventricle, here is your atrium. This would be the left atrium. Okay? So parietal pericardium is this fibrous sac. its job is to suspend the heart and the big blood vessels coming out of it. There's typically a very small amount of fluid in there to help lubricate, but you can get pericarditis. And you would actually hear a rub. Okay? No, this is a sheepy. We wouldn't be able to have a human here. We'd have to have a physician present in case I ripped off any remains. Okay, now, trachea is going to go down, and I'm probably going to gross you out by what I'm going to do. And the trachea is actually going to split. I don't know if you can see, the primary bronchus is extrapulmonary.
Okay.
So you'll see this would be primary. Does that make sense? Then primary is going to subdivide as primary subdivides, you're going to end up with a secondary. You see it? Where's it got that flappy thing? See the secondaries right there? Secondaries will lead to tertiaries, and then there are a total of 23 orders, going finally to the terminal bronchioles. So if I chopped a small piece off of this, I'd be able to see bronchioles, little tiny holes. Those are going to be the bronchioles. Now, you'll notice I'm going to be able to lift up a membrane on the lung itself. This that I'm able to lift up. This membrane is visceral pleura. This is not parietal pleura. Parietal pleura would line the walls of the thorax, and it would also line the superior surface of the diaphragm, which is this thing right here. This is the diaphragm. The center part of the diaphragm is called the central tendon, and that's what we have right here. Okay? This is actually the diaphragm itself, the thing that looks like corned beef. Right there. The superior surface of the diaphragm will have the parietal pleura on it. Once I go inferior, I'm going to see a more ridged structure, and that's going to be parietal peritoneum, because now we've changed cavities, haven't we? We've gone from one cavity to the next. So on the superior surface, it's nice and smooth. That's parietal pleura. This is the diaphragm muscle. Go below it, and you're going to find the ridged material the ridged material is going to be parietal peritoneum. Okay? That's pretty much it, except I will get out a cricoid for